Most people believe that sleep is always healing. That the more you sleep, the better your heart gets. But what if I told you that one very common sleep habit, especially after the age of 60, may actually be quietly damaging your heart every single night? My name is Dr. Zeno Phantom, and I've been practicing medicine for over 15 years. A few years ago, I had a patient, Ahmed, a 67-year-old retired school principal. He came to me with fatigue, mild chest tightness, and rising blood pressure. Nothing dramatic, but enough to concern him. He told me, "Doctor, I'm doing everything right. I sleep 9 to 10 hours every night." At first glance, that sounds ideal. But when we dug deeper and monitored his sleep, oxygen levels, and heart rhythm, we discovered something surprising. His nighttime oxygen was dropping repeatedly, his heart rate was fluctuating abnormally, and his inflammatory markers were elevated. Within 90 days of correcting just one specific sleep habit, his resting heart rate dropped from 82 to 68, his blood pressure normalized, and his energy came back. So today, I'm going to show you exactly 6 sleep-related habits that can silently damage your heart after 60, and more importantly, how to fix them naturally. Now here's why this matters. According to the American Heart Association, nearly 70% of adults over 60 have some form of cardiovascular disease, and sleep quality is now considered a major contributing factor. But most people miss this because they focus on how long they sleep, not how their body behaves during sleep. Here's what's really going on inside your body. After 60, your metabolism shifts, your sensitivity to insulin changes, your cortisol rhythm becomes more fragile, your airway muscles weaken, and your nervous system becomes more reactive. All of this turns poor sleep habits into real physiological stress on the heart. Think of it this way. Sleep is not just rest, it's a metabolic repair process. And if that process is disrupted, your heart doesn't recover. It deteriorates. In this video, we'll break down the hidden sleep behaviors that increase heart strain, the metabolic and hormonal damage happening overnight, and simple science-backed ways to protect your heart starting tonight. Most importantly, I'll show you how to turn your sleep into a tool for healing instead of harm. Let's start with the first mistake, and this one surprises almost everyone. Before we go deeper, let's map this out clearly, like we're standing in front of a whiteboard. There are 6 specific sleep-related habits that consistently show up in patients over 60 who struggle with heart issues, whether it's high blood pressure, arrhythmias, poor circulation, or chronic fatigue. Each of these habits affects a different part of your physiology. Here's what we're going to break down. 1. Sleeping flat on your back with restricted airflow. This can reduce oxygen delivery and strain your heart overnight, especially if you have undiagnosed breathing issues. 2. Sleeping too long, beyond your body's recovery needs. More sleep is not always better. In fact, excessive sleep is strongly linked to increased cardiovascular risk. 3. Late-night eating before bed. This keeps insulin elevated, disrupts fat metabolism, and forces your heart to work harder during what should be a repair phase. 4. Poor sleep timing and circadian disruption. Going to bed too late or inconsistently can elevate cortisol and disturb your autonomic nervous system. 5. Silent dehydration overnight. Low hydration thickens the blood, making it harder for your heart to pump efficiently. 6. Ignoring nighttime stress signals, like waking up frequently or a racing heart. These are not normal aging. They are warning signs from your nervous system. Now, here's the key idea I want you to remember as we go through each one. Your heart doesn't just rest while you sleep, it recalibrates. And if your sleep environment or habits are off, that recalibration turns into stress. We're going to go one by one, and I'll show you what most people get wrong, what's actually happening inside the body, and the exact habit you can change starting tonight. Let's begin with the first one. And this one surprises my patients the most. Sign 1, sleeping flat on your back. And this one surprises my patients the most. Most of my patients tell me, "Doctor, I sleep on my back because it's the best position for rest." It sounds logical, it feels neutral, and many people assume it's the safest posture. But here's what's actually happening inside your body. After the age of 60, the muscles that keep your airway open, especially around your throat, begin to weaken. When you lie flat on your back, gravity pulls those tissues downward. This partially blocks your airway, even if you don't have full-blown sleep apnea. That means less oxygen is getting into your bloodstream, and your heart has to work harder to compensate. Now your body goes into a subtle stress response, increasing heart rate, releasing adrenaline, and raising blood pressure, all while you think you're resting. Let me explain this with a simple analogy. Imagine breathing through a straw that someone is gently squeezing. You can still get air, but it's restricted, so your body starts working harder just to maintain normal function. That's exactly what your heart is doing during the night. And over time, this repeated oxygen drop becomes dangerous. According to the American Heart Association, sleep-disordered breathing, even mild forms, is associated with a 30 to 50% increased risk of hypertension and heart rhythm disorders. Here's the part most people miss. You don't need to be diagnosed with sleep apnea for this to affect you. Even slight airway restriction, night after night, can slowly strain your cardiovascular system. My recommendation for every patient over 60, try sleeping on your side, preferably your left side, for the next 7 days. You can place a pillow behind your back to prevent rolling over, or use a slightly elevated pillow to keep your airway open. Also, pay attention to signs like dry mouth, snoring, or waking up tired. These are clues your oxygen is dropping at night. If this is helpful so far, consider subscribing. I post content like this every day to help you take control of your health naturally. This is not a small issue. It's happening every single night. Not next month. Tonight. Sign 2. Sleeping too long. And almost nobody talks about this one. Most of my patients tell me, "Doctor, I sleep 9-10 hours, so I must be healthy." But here's what's actually happening inside your body. After 60, your body doesn't need more sleep. It needs more efficient sleep. Oversleeping is often a sign that your sleep quality is poor, not better. An extended time in bed can actually dysregulate your circadian rhythm, increase inflammation, and reduce heart rate variability. What the research shows is, studies published in the Journal of the American College of Cardiology found that people sleeping more than 9 hours had a 34% higher risk of heart disease compared to those sleeping 7 to 8 hours. Let me explain this with a simple analogy. Think of your sleep like charging your phone. Once it hits 100%, keeping it plugged in doesn't improve the battery, and it slowly degrades it over time. Same with your body. Too much time in low metabolic mode reduces circulation efficiency and metabolic flexibility. My recommendation for every patient over 60, aim for 7 to 7.5 hours of high-quality sleep, not just longer sleep. Wake up at the same time every day, even on weekends. If you feel tired despite long sleep, don't extend sleep. Fix the quality. Not next week. Start tomorrow morning. Sign 3. Eating late at night. This one is silently damaging your metabolism. Almost every patient I've seen with heart issues says, "I just eat a light dinner before bed on nothing heavy." But here's what's actually happening inside your body. Even a small meal before bed spikes insulin. And when insulin is elevated, your body cannot burn fat. It stays in storage mode. More importantly, your body shifts away from repair mode. At night, your body is supposed to lower insulin, increase growth hormone, repair tissues including your blood vessels. But late-night eating blocks this entire process. According to research published in Cell Metabolism, eating late at night significantly increases overnight glucose levels and reduces fat oxidation. Let me explain this with a simple analogy. Imagine your body as a factory that runs 2 shifts. Day shift, processing food. Night shift, repair and cleanup. If you keep sending in food at night, the cleanup crew never starts working. So damage accumulates. My recommendation for every patient over 60, finish your last meal at least 3 hours before bed. If possible, try a 12-14 hour overnight fasting window. Even something as simple as moving dinner from 9 p.m. to 7 p.m. can significantly reduce heart strain. If this is helping you see things differently, consider subscribing. This is the kind of practical health strategy most people never hear. Not later. Tonight. Sign 4. Irregular sleep timing. This disrupts your hormones more than you think. Most people say, "Doctor, I sleep enough. Timing doesn't matter." But here's what's actually happening inside your body. Your body runs on a circadian clock, a precise hormonal rhythm. After 60, this system becomes more fragile. When you sleep at inconsistent times, your cortisol, your stress hormone, becomes dysregulated. That leads to higher nighttime blood pressure, increased inflammation, disrupted heart rhythm. Research from the American Heart Association shows that irregular sleep schedules are linked to a higher risk of cardiovascular events and metabolic dysfunction. Let me explain this with a simple analogy. Your body is like an orchestra. Each hormone, cortisol, melatonin, insulin, plays at a specific time. If one instrument plays out of sync, the whole performance breaks down. My recommendation for every patient over 60, go to bed and wake up at the same time every day, within a 30-minute window. Aim to sleep between 10 p.m. and 6 a.m. for optimal hormonal alignment. Consistency is more powerful than perfection. Not someday. Tonight, sign 5, going to bed dehydrated, and this one is extremely overlooked. Most of my patients tell me, "I avoid drinking water at night so I don't wake up." Sounds practical, but here's what's actually happening inside your body. When you're dehydrated, your blood becomes slightly thicker. That makes it harder for your heart to pump efficiently, increasing cardiovascular strain, especially during the night when circulation naturally slows. According to studies in the European Journal of Nutrition, even mild dehydration can increase heart rate and reduce vascular function. Let me explain this with a simple analogy. Think of your blood like engine oil. If it's too thick, the engine has to work harder. That engine is your heart. My recommendation for every patient over 60, drink a glass of water 60-90 minutes before bed, not right before sleeping. Also ensure proper hydration during the day. Aim for steady intake, not large amounts at once. This supports smoother blood flow and reduces nighttime stress on the heart. If this is opening your eyes, consider subscribing. I break down complex health topics like this every day. Not next week. Start today. Sign 6, ignoring nighttime wake-ups. Your body is trying to tell you something. Almost every patient says, "I wake up at night," but that's just part of aging. But here's what's actually happening inside your body. Frequent waking is often a sign of blood sugar drops, elevated cortisol, oxygen fluctuations, nervous system stress. Your body is literally sending distress signals. According to the National Sleep Foundation, frequent nighttime awakenings are strongly associated with increased cardiovascular risk and poor autonomic regulation. Let me explain this with a simple analogy. It's like a fire alarm going off in your house. You can ignore it, but that doesn't mean there's no fire. My recommendation for every patient over 60, if you wake up consistently, check your last meal timing. Avoid sugar or heavy carbs at night. Practice slow breathing before bed, 4-6 breathing pattern. And most importantly, don't ignore the pattern. Track it. Your body is giving you data, not later. Tonight, let's bring this together clearly. Your heart does not simply rest during sleep. It recalibrates, repairs, and resets your entire system. But as we've seen today, certain sleep habits, especially after 60, can quietly turn this healing time into stress. We covered how sleeping on your back can reduce oxygen, why oversleeping may increase heart risk, how late-night eating blocks repair, the importance of consistent sleep timing, why hydration affects blood flow, and how nighttime awakenings are warning signals, not normal aging. Here's what's really going on inside your body. Your metabolism, hormones, and cardiovascular system are all connected, and sleep is where they either recover or break down. The good news? These are not complicated medical treatments. They are simple daily habits. Try just one of these changes today. Sleep on your side. Stop eating 3 hours before bed. Fix your sleep schedule and track how your body responds. Because when you improve sleep, you improve your heart, your energy, your weight, and your longevity. If this added value, like the video and subscribe to join others optimizing their health naturally. I'll see you in the next one.